So lung sounds. This is how it is. Crackles. They're high-pitched. They're heard during inspiration, but they're not cleared by a cough. They're discontinuous. Rhonchi. Basically, they're loud. They're low. Coarse sounds. Sounds like a snore during inspiration or expiration. They may clear with cough. This is continuous. Wheezing. It's a musical tone of noise during inspiration or expiration. Usually longer during expiration, and it's continuous. So these are all the 3 different types of lung sounds that you can expect to hear, and each one needs a certain type of treatment and can be underlying cause. And these are very important things to understand when you're assessing your patient for different lung sounds.